Hello, I'm Holly Tanner with the Herman Wallace Pelvic Rehab Institute, and I'm here with Mora Pluchino, who has written a new ethics course. In addition to being a lead teaching assistant, Mora has also been helping out with curriculum work and now has this new course to offer. Mora, can you tell folks a little bit about yourself and your background?
Sure. I am a doctor of physical therapy and I graduated from Stockton University in 2019. I've been a PT for 13 years. I've worked in the same outpatient hospital based facility for that time. I also have my own side company that I see patients that can't make it to the outpatient place. And I am a mom, a wife. I'm a owner of a golden retriever and lots of foster kittens. I run a Girl Scout troop. I have like a whole zoo in my house. And yeah, and I am a lead TA for Herman and Wallace, which is something I love to do, and just started writing some content for you guys. And I have written a couple books for Amazon. Yeah, that's me.
Well, tell us about your books.
Sure. So I one book I wrote is called The Poop Train, and it's like a tour of a child's digestive tract. I don't know why my computer's doing that. But it's just a little rhyming book that talks about kind of what it's like to go potty and how, how poop is made in the body, and then has some resources in the back for parents for helping manage their child's regular GI system. This is something I give to parents when they come in with, kids with a little bit of poop issues, because I am also a pediatric therapist and I do pediatric pelvic floor stuff too. And then my other book is called Pelvic Floor 101, a visual tour of the pelvic floor. And that is a visual tour of the pelvic floor. So it is divided into sections based on physiological anatomy. And it's what I use when my patients come in and they'll have been sent by their doctor who said, go see Mora, she'll fix you. And then they come in, they're like, oh my God, this lady's like a voodoo witch doctor. She wants to look at my private parts. I just know it. And they're really nervous at first a lot of times if they haven't had a friend kind of tell them what's going to happen. So I created this, and it's just a bunch of pictures that are, very easy to see and easy to understand. And we just go through kind of what the pelvic floor is, what pelvic health is, what the abdominal canister is, talk about poop, because people have poop issues that they never knew they had. And just to kind of, by the time that we get to the examination and evaluation part of pelvic health, they're like, oh, that makes total sense why you want to look at that. Like, go ahead. Instead of being like, you want to do what? And that's, kind of what informed consent is, which I think we do a really good job as pelvic health PTs, and Herman and Wallace has really educated all of their practitioners on.
Mhm.
So, yeah.
Well, who or what inspired you to want to write a course about ethics for rehab clinicians?
So, my work wife, my work best friend, and I were sitting at lunch and we were talking about how we're in New Jersey and we have to do an ethical requirement every 2 years. And we were trying to think of like a course to take together. And we went to Stockton University, and one of our professors is like an ethical expert who teaches for the APTA. And we've taken her course, over and over. And, there's only so many times that you can take the same course, before you're like, okay, let's do something different. And so I was like, yeah, I bet Herman and Wallace has one. Let's see if they have one. And I started looking on the website. They really couldn't find anything. And then I emailed the TA person because, we have a good relationship. I said, do you have one, or is there one coming up, or someone writing one? She's like, no. And so she put me in contact with Holly. And when we spoke, there wasn't an ethics course. And I was like, okay, do you think I can write it? And so we started writing it. And that's kind of how it was born.
It's wonderful. And so, what can folks expect if they come to an ethics course? Is it going to be lecture? Is it going to be group work, case studies?
So we are going to it'll be about an hour pre-recorded pre-work. I kind of tried to break it into small pieces so you can kind of, get a little bit of education on what ethics is, and then take a break, and then kind of what an ethical model is, and take a break, and then how to use one, take a break, and then going over some core values, which is really part of the ethics process. And then in person, we're going to do a little bit of lecture in relation to like just pelvic health and ethics specifically for this class. And then we'll have some cases that we'll go over and do some group work. And then we'll have an ethical expert actually come and do live question and answers with us for about, I think, 45 minutes. And I will also invite all of the people as part of the pre-course work. All participants can send me in some case studies, and that'll be part of their pre-course work, is they can do like this RIPS model worksheet. and send it in to me. And then that way I can incorporate that into the lecture of that day. So it's, going to be interactive. And, my goal is that if you have burning questions or burning issues that you're really stressed about, that you would leave this kind of having that information provided to you, or at least like where I can get that information or where I can find the support for why this makes me feel icky and how I address it with, my boss or my organization or myself or my patient. Because that's a lot of times ethical situations are really just something that make us kind of feel yucky in our tummy. And you're just kind of like, oh, it doesn't feel right.
Mhm. And sometimes those situations also make us either feel embarrassed or like maybe we contributed or didn't contribute in the right way to a
Mhm.
scenario. And so we don't always bring them up to other people out of that embarrassment, or we just don't really know what pathway to take. And
So
whether or not,
so I see this all the time. Like I'm in a lot of groups on Facebook, like pelvic health groups and peds and women's health and trans non-binary and just general ones. And, a lot of the questions that people ask are ethical questions. I think they're asking them as a professional question, but I'm like, oh, this is an ethical question. How do I bill for this? How do I tell my boss I can or can't do this? One recently was, can I reuse a biofeedback sensor? And I'm like, heck no, you can't. But there was a lot of conversation about that. And, the boss was pressuring the person to do this. The person knew the answer was no, but they didn't know how to say no. And so this course would give you the tools to say, like, no, I can't do that for this, this, and this reason, as in my guidelines and in my practice act and core values as being a PT or an OT. Here's the clear reasons why I can't. Because we have all these people working for us in the APTA or the AOTA that are creating all these ethical guidelines and all this information for us to give us the support. I don't want to be one of those people because it is a lot of work, a lot of things to read, but they're giving us all that foundation to have that support in our clinical practice.
well, and so folks who have an annual or an every other year requirement don't get bored and have to take your course over and over again. You are developing this into a course series. So
Yep.
what kind of topics have you already come up with for how to kind of frame each of these courses that you're developing?
Yep. So we decided to start basic with the first one is just like people who treat in pelvises. And then the next one we have planned for December 10th. We're going to do like the legal lens of pelvic health. So like, am I going to get sued for this? Is it just not the right thing to do? Can I be sued for abandonment of care is one that comes up all the time. Am I abandoning my patient or am I, segregating or, discriminating? So that's going to be more the legal lens of that. And just also what our rights are as healthcare providers, because I feel like a lot of the ethics classes I have seen that maybe address pelvic health, it's from the perspective of that therapists are abusing their patients. But I think when you work in the pelvic health world, you realize that it can go the other way too, or it can be a back and forth kind of thing. So it's not just like sexual harassment of us hurting them, but sometimes, our patients might say something that's inappropriate to us or cross boundaries that are not, we're not comfortable with. And so again, giving people those tools. And then looking forward for the next year, I think we talked about doing something with inclusivity. So like LGBTQIA plus, non-binary, transgender care, and making sure that that population is getting the services that they deserve. And then also, I think there's a really good conversation for this in like end of life care and oncology, and being able to make choices around quality of life there. And then kind of what else comes up.
Right. Well, and I think your background in pediatrics as
Mhm.
well is so
Mhm.
rich because I'm sure folks are going to have some questions about just dealing with family expectations and challenges
Even
as
just
well.
consent with children is hard. If you have a child that comes in and let's say they're 5 or 6 and you explain everything and you say, can I look at your pelvic floor? And that kid still says no.
Yep.
And it's a hard no. And their parent still is trying to force them. And you're like, no, I'm sorry. I can't." That your child said no. Where are you ethically? Because legally, yeah, you could do it, but ethically, are you going to violate that child's trust if you go ahead and force them to do an examination they're not comfortable with yet? There's different ways that we can make decisions. So there's care based, there's rules based, there's facility based, there's different ways that we can make decisions. And so sometimes you might choose the same one every time. You might be rule based. If you're Sheldon Cooper from The Big Bang Theory, you're going to go rules based every single time. But you could be the bleeding heart that goes care based every time, and you're willing to put your license on the line to kind of do something that may not be as legally in the black, but is what your patient needs.
Yeah.
And so that's kind of where we can find where your comfort level is as a practitioner and in putting labels and words and definitions on that. And the course manual, I think, is going to be really helpful. It has like a whole definition section that's all, alphabetized. So it has a nice glossary. So you can be like, what the heck does she mean by cares based? And you can go and read it. And it says, okay, that's what that means. Or what is altruism in reference to pelvic health? Okay, there we go. So, you have something to reference back and use as a guide in the clinic.
Well, we are so thrilled that you're as passionate as you are about this topic because, as you've identified, there's a real need for it. And so,
Mhm.
looking forward to these upcoming courses. And again, grateful for all that you do for the Pelvic Rehab Institute.
Thank you.
Thanks, Mora.